I'd like to welcome you to this session of the virtual online oncology congress. This session is upper aerodigestive diseases other than lung cancer, and we will focus on head and neck cancer, panel discussion, human papillomavirus and head and neck cancer and its clinical implications and novel agents for the treatment. I'm David S. Ettinger, Alex Grass Professor of Oncology at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins, and I would like to welcome you, and I will be the moderator. The two panel members are Christine Chung, Associate Professor of Oncology at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins, and Ezra Cohen, Assistant Professor of Medicine at the University of Chicago School of Medicine.
The overall survival was quite promising at 4 years of 75%, with a disease-specific survival of almost 90%. And we looked at gene copy number as a predictive or at least prognostic marker in this patient population. It turns out that about half the patients had a high EGFR gene copy number, and if one follows the hypothesis, using an EGFR inhibitor in these patients with high EGFR gene copy number should actually have produced a favorable outcome, and had these patients, and we expected these patients to actually do better. The reverse was in fact true when we looked at patients who had high EGFR gene copy number, classified as EGFR positive. They did worse with respect to overall survival, and they did worse with respect to time recurrence.